Hi, so I've come to talk to you about our experience with spinal muscular atrophy, and in fact I think I will be echoing a lot of what Lindsay has been talking about this morning, except we're not as far down the process, unfortunately, as they are. So I'm first going to tell you a little bit about the SMA Trust and SMA Europe, very briefly about SMA, our quest for treatments for our population, and then the time that it has taken for approval, and what our patient groups have done, what role they've played, and where we are in the UK. So I work for two organisations. The UK-based organisation is called the SMA Trust, and we're also part of an umbrella European organisation called SMA Europe. SMA Europe includes 15 organisations from around Europe, and has proved to be a valuable collaboration source. So just briefly, a little bit about SMA. So SMA is a genetic degenerative neuromuscular condition. It is caused by the mutation of a faulted gene in SMN1. SMN1 produces a protein called SMN, which is crucial for the survival of motor neurons. So in SMA, this protein is not produced in adequate quantities, the motor neuron dies, and that causes muscle atrophy and therefore lack of movement, primarily of the upper body and walking, but also includes feeding and swallowing. I also need to stress that SMA has got several types. So you've got type 1, which is the most severe, where babies die within the first 2 years of life. You've got type 2, type 3, and type 4. Type 4 is adult onset. And this is quite important because that will touch on what Lindsay talked about earlier about accessing treatment for all this population. So the cause of the disease was found in 1995, down to this gene, and millions has been obviously spent on research. And finally, in October 2016, one particular treatment seemed to have some effect, and the company behind it submitted their file to the FDA and to EMA. So what was the timeline for this? So it was approved in December last year with the FDA. So in August 2016, Biogen, which is the company involved with nusinersen, was allowed to stop their trial prematurely because the data was very efficient. So they've been in talks with the regulators through all this process, and were allowed to stop and file their dossier, which happened in October. In December, we found out that the FDA had approved the drug for all types of SMA patients. We had to then wait a few months later. EMA recommended the approval of nusinersen for also all types of SMA. And finally, on the 1st of June 2017, the European Commission granted Biogen the license. So what role did we play in the approval of this drug? So collaboration, again, is key. So we collaborated with all our SMA Europe partners. We also collaborated with the other SMA organisations in the UK. And we supported Biogen by the first thing we wanted to be able to do is to represent the patient voice and say what patients were expecting after this treatment. And so we carried out a survey which spans most of the European countries that we're involved with. And this was published in Neuromuscular Disorders, just to make sure that we understood exactly what the patient wanted. And actually that survey was overwhelming, and that the answer from all the patients was pretty much the same, and all they wanted was a drug to just stabilize their condition. It didn't really matter to them whether it would improve their condition, they just didn't want any more degeneration, and that was really key, overwhelming message. So this survey was very instrumental for the company Biogen, so they were able to say, look, we're not looking for increase in function, all they're wanting is stabilization. So that was very helpful. We also, along with all our stakeholders, so again, like Lindsay said, it's important to get all your stakeholders together, our clinicians, researchers, patients, and all other groups together, and we held a workshop at EMA to primarily educate them about SMA and what the patients wanted. and that proved to be very efficient. So where are we in the UK? So in the UK, we're quite a lot behind Climb and their drugs. So in January last year, we held one of these scoping workshops, and we were able to answer questions about SMA, and just to see whether NICE would evaluate the drug. We were then told that by this summer we would have an answer as to whether or not they would look at it, and if they would look at it, how, which pathway they would take. So here again, and I think again I echo Lindsay, so that the two pathways we're looking at are a bit of a yin and yang situation for SMA, in that if we go for the highly specialized technology assessment, then it is likely that only one type of our population will be given access to the drug. So we'll have to worry about our other types 2 and 3. However, if it's going to go through the other pathway, the drug is too expensive, and that's unlikely to go either. So it's like we very much feel that it's going to go through the highly specialized technology assessment, but then there's a limit of 500 patients. We have more SMA patients in the UK than 500. So we're in a tricky position. We're still fighting for a broad label. We're also having discussions with the pharmaceutical company to see if they can change their pricing scheme. The drug is thought to cost about £230,000 a year per patient, so it's very expensive. And it's not just the drug, it's also the it's the intrathecal administration, so all the costs associated around the administration of the drug. So we're still. So apparently next week we're meant to hear whether NICE is going to assess our drug or not. A meeting is planned to discuss the eventual outcome, if it's a no or a yes, or if it's a yes, which route they're going to take. So we'll be able to hopefully a bit later make plans on how we're going to deal with this. So in summary, again, to echo Lindsay, I think it's just to highlight what you can possibly do is forge collaborations with as many other groups as you can. Do try and have a survey of what your patients exactly expect from the drug, so you can reinforce any applications made by the pharmaceutical company. At the UK level, try and host a scoping workshop at NICE. We've talked to the pharmaceutical company about price, trying to see if there's any negotiations possible there on trying to either decrease or work something out with their pricing scheme. We also held, along with, Muscular Dystrophy UK held an APPG in the summer, so we went and presented SMA again there. We also got all our clinicians, researchers, and groups to write a position statement to NICE to say exactly what we're expecting after the outcome. And we are now expecting a decision imminently as to whether it's going to be assessed.